Hi, my name is Dr. Kat Kesty. I'm a double board certified dermatologist and a fellowship trained laser surgeon at St. Petersburg Skin and Laser in St. Petersburg, Florida. This episode is going to answer all of your Botox questions. To start off, let's talk about all the different types of Botox on the market in the United States right now. So there's Botox, Dysport, Juvo, Xeomin, Daxxify, and Lativo. So there are 6 formulations of Botox, which some people will call it Botox and some people will call it wrinkle relaxers or neuromodulators. It's all really the same thing. Think of how we call Kleenex a Kleenex. There are different brands of Kleenex, same with Botox or wrinkle relaxers. So let's talk about the differences between the different brands of wrinkle relaxers or Botox. There's 6 different brands approved in the FDA right now. And I think it's a little bit controversial, depending on who you ask, if there is a difference. Personally, after having injected 15,000 faces with neuromodulators or wrinkle relaxers, I think that the differences lie more in the dose of wrinkle relaxers and who injects it than the specific brand. My nurse can draw me up any of those 6 brands and I can get a great cosmetic result for patients as long as I know exactly where I'm injecting it and injecting the appropriate dose, which we'll get more into later in this podcast. So let's talk about when Botox kicks in. Botox kicks in about 3 to 4 days, but you see results at 14 days. So when you're talking about getting an injection on day 1, you want to wait 14 days to go follow up with your physician or whoever's injecting it to see if you need a touch-up. Kind of let all of it settle in over 14 days after the injections. Let's talk about how long wrinkle relaxers last. Wrinkle relaxers on average last between 2.5 to 4 months. And the key point to duration of wrinkle relaxers is dose. I like to tell my patients that dose is duration, and people require different doses to get the same cosmetic effect. If you're 25 and you're coming in for maintenance wrinkle relaxer treatments, just so your wrinkles don't get etched in over the next 10 to 15 years, you're going to be dosed differently than someone who's never had any cosmetic treatments and comes in at 60 years old. The FDA-approved dose for the upper face is going to be 64 units, and that is going to last, on average, the women in the trials, 3 months. So whether you're above 64 units or below 64 units, you're going to get a different dose depending on your skin, your age, and what other cosmetic procedures you're having done. Let's talk about where you can use Botox. So you can use Botox here or in the glabella to treat those 11 lines. You can use it for a subtle brow lift to lift the tail of the brows by 0.5 to 1.5 millimeters. You can use it for these wrinkles on the forehead. You can use it for these wrinkles or crow's feet. You can do your bunny lines here. You can put it around the lip for a lip flip to kind of relax that orbicularis oris muscle. If you push on the upper lip, you can see kind of the cosmetic result of putting some Botox there. You can use it in the chin to relax the chin if you're using a lot of your chin muscles and facial expressions. You can use it along the jawline and in the neck to more clearly define the lower face and to prevent that neck aging. You can also use it in your traps. If you notice that you're getting a lot of tension in your back, you can put some in your traps and that will kind of soften them and help with the back pain. Let's talk about how to combine wrinkle relaxers with other cosmetic treatments. If you're doing dermal filler for volume restoration in the cheeks or the jaw, temples, somewhere like that, you can do Botox on the same day as dermal filler. If you're talking about laser resurfacing, you want to do that on a different day because the swelling from the laser resurfacing can interfere with the effects of the wrinkle relaxers. Something simple like a vascular laser or microchannel, PRP injections, just ask your physician because sometimes we will do that on the same day as Botox and sometimes we will space it out. But definitely for an overall anti-aging or aesthetic treatment plan for you, Botox is going to be a key component of it, and definitely talk to your physician about how to integrate that into your overall cosmetic goals. Thank you so much for listening today. If you have any questions at all, feel free to send me a DM or leave a comment on this, and definitely hit that subscribe button. We have a lot of great aesthetic information coming your way.